The first minimally invasive surgeries were pioneered in the 1980s. Since then, the practice of using long-range instruments through tiny incisions has evolved, with robotic systems now at the cutting edge of surgical procedures. Dr. Moshe Perez of Boca Raton Regional Hospital and medical director of Boca Fertility joins us now to tell us a little bit more about the evolution and exactly what can be done with robots in the operating room. Thanks so much for joining us. This is such a fascinating topic for me. First, can you describe what the robotic surgical system is and how the hospital uses it?
If you can imagine a camera which is inserted into the abdomen of a patient, and instead of just the surgeon using 2 hands, now he's got 4 hands at his disposal. And the procedure allowed the surgeon to control the surgical movement in a way that has never been established before.
And what procedures and parts of the body can this system actually be used on?
The applications keep on increasing year after year in terms of the type of procedure can be done. And it's done for gastric bypass, gynecological conditions, prostate cancer, and colon and rectal cancer.
What are the advantages for the patients in opting for this type of procedure? Because quite frankly, it sounds a little scary that a robot could be operating on me.
Well, you have to remember that the robot cannot make any decision on its own. The surgeon has to put his input into the robot in order for the system to perform its duties. So it's not really truly robotic in terms of the machine having its own decisions to make and how to perform the procedure.
So what are the advantages for a patient?
The advantage for the patient is that through tiny incisions, which really measure between 1/2 and 3/4 of an inch, and typically there are 3 or 4 incisions like that, a very complex procedure is being done, which typically would have required a major operation, a large incision. So the procedure is a lot more comfortable for the patient with shorter hospital stay and less complications.
Are there advantages to physicians like yourself?
Oh, absolutely. I think that it allows the physician to perform the operations in a way that has never been done before, utilizing a very high-definition, 3-dimensional view of the abdomen, and allows the patients to have a much shorter hospital stay. So it's absolutely beneficial for the patient. That's what, as physicians, we're really looking forward to.
I know anytime a patient goes in for an operation, they want to know the pros and the cons of any kind of operation or surgery. Are there any drawbacks to this?
There's no real drawbacks to the procedure itself. The procedure itself is extremely magnificent in terms of revolutionizing surgical treatment for women disorders.
And are there any treatments or any kind of patient conditions that cannot be treated with this type of system?
Well, for gynecological procedures, almost every single gynecological procedure can be performed through the Da Vinci robotic system. There are certain conditions such as tubal pregnancy do not require the robotic system. But for complex procedure, it's really second to none.
Well, as I mentioned at the beginning, this is really such a fascinating topic for me and such an evolution in where we are going in the medical field. Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.